Okay, let's unpack this. We've got a market report here, and it paints a picture of a market set to, well, almost double in less than 10 years.
Yeah, it's pretty striking.
We're talking about the global market for treating nocturia.
Which is, the medical term for waking up multiple times a night needing the bathroom.
Exactly. And it's a bigger slice of the healthcare pie than you might think. So this deep dive is all about getting into the details of this report, the size, the drivers, what's happening.
Right. Our mission here is basically to guide you through it. We'll pull out the key numbers, look at what's pushing the market forward or holding it back, spot the trends.
And check out who the main players are.
Yeah, just give you a clear, sort of distilled view of this specific healthcare area based on this report.
And it's a pretty thorough source. It gives us the 2025 numbers, looks back a few years.
0.2081 to 2024, yeah.
And projects all the way out to 2033. Plus, it slices the data in really helpful ways.
Like by drug type, the actual cause or indication, distribution channels.
And geographically, too, regions and specific countries.
It's like a snapshot and a roadmap, all rolled into one, based on this report's findings.
Okay, let's jump right in then. What are the big headline numbers? Global market size for nocturia treatment in 2025.
According to the report, it stands at USD 651.4 million for 2025.
So nearly 4.7 billion US dollars. That's already pretty significant. Where's it projected to go by 2033?
The forecast hits USD 899.58 million by 2033.
Wow. Okay, like we said, almost doubling. What does that mean in terms of an annual growth rate?
That translates to a compound annual growth rate, a CAGR, of 8.60%.
8.6% for a market this size. That's robust growth.
Absolutely. It's quite strong.
Does the report give a main reason why it's expected to grow so much?
It points strongly towards increased awareness. Awareness about urological health generally and nocturia symptoms specifically.
Ah, okay.
When people and doctors are more aware, you get more diagnoses, and that naturally leads to more demand for treatments.
Makes perfect sense. Awareness leads to diagnosis, leads to treatment.
Right.
Okay, so now let's look at where this market is concentrated today. The regional breakdown for 2025.
Right, looking at the big regions. North America had the largest share in 2025, over 37% actually.
Over a third.
Yeah, which translates to USD 1721.02 million. Europe was next, a bit over 29%. That's USD 448.91 million.
Okay, so North America is currently the biggest player in terms of market size. Is it also the fastest growing?
No, actually. According to these projections, North America is looking at a 6.4% CAGR, and Europe around 6.9%.
Still decent growth.
Decent, yes. But the Asia-Pacific region, APAC, is where the really high growth is projected. It held about 24% of the market in 2025.
Around $1.1 billion.
USD 1,116.34 million, yeah. But its projected CAGR through 2033 is a hefty 10.6%.
Wow, 10.6%. That really stands out compared to North America and Europe. What about the other regions mentioned?
Let's see. South America accounted for over 3.8% in 2025. That's USD 176.75 million, with a projected CAGR of 7.6%. The Middle East was around 4%, USD 186.06 million, and projected at 7.9% growth.
Okay.
And Africa, around 2.2%, or USD 102.33 million, projected to grow at 8.3% CAGR.
So pretty solid growth expected almost everywhere, but APAC is clearly the standout for projected expansion speed.
Definitely the growth engine, according to this report.
It's interesting, isn't it? North America has the current lead, but the future growth seems to be shifting east. Let's maybe add a bit more detail with some specific countries looking at their 2025 size and projected growth rates from the report.
Sure. So within North America, no surprise, the U.S. has the lion's share, USD 357.88 million in 2025.
Huge.
But its projected growth, 6.2% CAGR, is actually a bit lower than the regional average. Canada, though, at USD 206.52 million, is projected to grow faster at 7.2%.
And the report links that too.
Its aging population and improving healthcare access. Mexico is also solid, USD 156.61 million, projected at 6.9% CAGR.
So variations even within the leading region. What about Europe? You mentioned the UK showing strong growth earlier.
Yeah, or Germany has the biggest market share in Europe. USD 267.08 million in 2025, growing at a projected 7.1% CAGR. But you're right, the UK at USD 226.62 million is projected to lead growth-wise at 7.7% CAGR.
And the reason cited?
Advanced healthcare systems and, again, rising awareness. Other big European countries like France, Italy, Spain, they're generally clustered in that 6 to 7% CAGR range. Pretty consistent growth across the board there.
Okay. And now for that high-growth APAC region. Who are the leaders there?
Well, China is the dominant market in APAC, size-wise,
Yeah.
USD 468.86 million in 2025. And it's got a strong projected CAGR too, 10.1%.
Drivers there.
The report points to its huge aging population and growing health awareness. But India shows even faster projected growth.
Really?
Yeah, a 12.5% CAGR projected. Its 2025 market size was smaller, USD 111.63 million, but that growth rate is something else. The report links it specifically to the rising prevalence of diabetes.
The lifestyle disorder connection.
Exactly, that contributing factor we'll touch on later, plus developing healthcare infrastructure. Japan and South Korea are also significant, both projected around 9-something% CAGR.
That India example really drives home how specific health issues can fuel market growth in certain areas. It feels like the overall story is strong growth everywhere, but APAC is really accelerating, pushed by demographics and specific health factors.
That sums it up well geographically. So that's the where. Now let's pivot to the what. What treatments are actually driving this market? The report breaks it down by drug type. We've got anticholinergics, desmopressin, antibiotics, antispasmodics, and a catch-all others category.
Right. Which one's the current heavyweight, holding the biggest share?
That would be desmopressin. It accounts for a major share.
Why is that?
The report says it's down to its effectiveness, especially in reducing how much urine the body makes at night. It's a synthetic version of a natural hormone, vasopressin, and it basically helps the kidneys concentrate urine. So it directly tackles nocturnal polyuria, which the report identifies as a leading cause of nocturia. It's widely prescribed, well-established, comes in different forms like pills and nasal sprays.
Got it. So desmopressin is the established go-to for a primary cause. Which drug category is pegged as the fastest growing?
That's the anticholinergic drug segment. These are often used for overactive bladder, which is another common contributor to nocturia.
How do they work?
They work by relaxing the bladder muscle. This helps reduce that sudden urge to go and the frequency of needing to get up at night. The report connects their fast growth to, well, increasing awareness again this time about bladder health, plus more diagnoses of related symptoms, and ongoing drug development, like more convenient oral versions becoming available.
Interesting dynamic. One category leads based on treating a very common cause, while another grows fast by addressing a different, increasingly recognized issue. That ties nicely into the next segmentation, by indication type. Basically, the underlying reason why someone has nocturia. The report lists mixed nocturia, low nocturnal bladder capacity, and nocturnal polyuria.
Exactly. And aligning with the desmopressin dominance, nocturnal polyuria accounts for the largest market share by indication.
Because it's the most common cause cited.
Yeah, the report identifies it as the most frequent underlying issue, the body just making too much urine overnight. It's often linked to aging, hormonal shifts, chronic conditions like heart failure or diabetes.
Right.
And because there are targeted treatments like desmopressin available, it makes sense it's the largest segment. Plus, awareness among doctors and patients about this specific cause is rising.
Okay, so if nocturnal polyuria is the biggest slice, following the pattern, which indication type is growing fastest?
That would be low nocturnal bladder capacity. This is where the bladder itself just can't hold as much urine during sleep.
Why is that segment growing quickly?
The report suggests it's gaining traction because its role is being recognized more. Better diagnostic tools like asking patients to keep bladder diaries or using more advanced urodynamic studies are helping pinpoint this specific problem.
So better diagnosis again.
Right. And that leads to more tailored treatment strategies, things like behavioral therapy, but also medications, including those anticholinergics we just talked about. So
Right.
better diagnostics plus expanding treatments equals faster growth for this segment.
Makes sense. Improved diagnostics let us pinpoint the specific problem, driving growth in treatments for those specific causes. Okay, so we know the drugs and the causes. How are these treatments actually reaching patients? The report looks at distribution channels, hospital pharmacies, retail pharmacies, and online pharmacies.
Right now, hospital pharmacies hold a prominent share.
That seems logical.
Yeah, hospitals are often where moderate to severe cases get managed, especially when prescriptions are started by specialists. They're key for dispensing drugs like desmopressin or anticholinergics, particularly for inpatients or after specialist consultations. Plus, they're often linked to the diagnostic services needed.
Okay, so hospitals are key currently, but which channel is exploding in growth? I think I can guess.
You probably can. It's online pharmacies,
Mhm.
identified as the fastest growing distribution segment.
Fits the broader trend.
Absolutely. It's driven by, rising internet access globally, people wanting convenience, privacy. Often competitive pricing, too,
Hmm.
especially helpful for managing chronic conditions like nocturia can be.
And technology helps.
For sure, secure payments, telemedicine, getting regulatory support, it all makes online pharmacies more practical and popular. It also helps expand access, maybe in rural or underserved areas.
So the delivery mechanism is changing quite fundamentally, mirroring what we see across healthcare. Okay, we've covered the size, the geography, the treatments, the causes, the distribution. Let's zoom back out. What are the big picture drivers really pushing this market forward, according to the report?
The report boils it down to three main things. First, supportive government initiatives trying to boost awareness of urological health. Second, the rising incidence of lifestyle disorders like the diabetes example in India, which can contribute to nocturia.
Mhm.
And third, the big one, the rising global geriatric population. Aging is just very strongly linked to higher rates of nocturia.
Those are definitely powerful, large-scale drivers. What about the brakes? What's holding the market back or creating challenges?
Two key restraints are highlighted. One is the side effects that can come with some of the common medications that can make it hard for patients to stick with treatment.
Understandable.
The other is simply a continued lack of awareness among patients about nocturia itself. Many people might just accept it as, a normal part of getting older.
Rather than a treatable medical condition.
Exactly. So they don't seek help, which limits the market.
So, challenges on both the treatment side, tolerance, and the awareness side, recognition. Okay, finally, what about emerging trends shaping the future here?
The report flags two key trends.
Oh.
One is increased investment in R&D, trying to find new, innovative therapies.
Which could help address those side effect issues.
Potentially, yes. And the second trend is the development of combination therapies. Therapies designed to tackle multiple causes of nocturia simultaneously, since it can often be complex.
That makes sense too. So what's the competitive vibe like? Who's doing what in this space?
The report describes it as being shaped by key pharmaceutical companies, really focusing on innovation, new drug development, and also strategic partnerships.
Though working together sometimes?
Yeah, or collaborating on promotion. The major players are putting money into R&D, both to improve existing drugs like desmopressin, maybe make them safer or more convenient, and also to develop totally new treatments, like those newer anticholinergics. Competition also heats up based on how they get drugs to market using hospitals effectively, but also tapping into that fast-growing online channel. Plus, you see continuous product launches and efforts to expand into new countries.
Does the report give any concrete examples of companies making moves?
It gives a couple, yeah. One is from April 2025, Amara Therapeutics launching a clinical trial for something different, a digital therapeutic.
A digital therapeutic, like an app.
Sort of, yeah. A digital solution aimed at treating overactive bladder in women. They got significant funding, $4.8 million total. The idea is to tackle symptoms like nocturia, but also maybe get around some healthcare access problems. It shows innovation isn't just about pills.
That's fascinating. A non-drug approach gaining traction. What was the other example?
The other was from back in June 2021. Eurovant Sciences and Sanovian Pharmaceuticals announced a co-promotion deal for a drug called GMTC.
For overactive bladder.
Right, approved for OAB symptoms. The deal involved using Sanovian's larger sales team to reach primary care doctors, not just specialists. It's an example of a strategy to broaden the drug's reach in the market.
Okay, so summing up, we've got a market that's already large and set for major growth, nearly doubling by 2033. It's driven by big factors like aging populations and rising awareness.
But also faces challenges from medication side effects and lack of patient awareness.
Right. And we're seeing innovation in R&D for new drugs and combination therapies, plus really interesting shifts in delivery, with online pharmacies booming and even digital therapeutics entering the picture.
Exactly. It's a substantial market now, projected for significant growth fueled by these fundamental demographic and health trends. But it's also clearly transforming in how treatments are developed and how people access them. It's dynamic, influenced by global health patterns, and increasingly technology.
It really is. And thinking about those examples the report gave, the digital therapeutic trial, the rapid rise of online pharmacies, it does leave you wondering, doesn't it? It makes you consider, how might technology continue to reshape not just the treatments we have, but the entire way people access care for conditions like nocturia in the coming years? It really suggests the future of healthcare delivery could look quite different from today.